Hello, I'm Debra Umberson, and I'm a sociologist and director of the Center on Aging and Population Sciences at the University of Texas at Austin. Today, I'll be talking about some research we've been doing on the death of family members with a particular focus on racial disparities in this experience. I use a population perspective in my research, which means that I rely on nationally representative, typically longitudinal data to look at patterns in the population. And we do this to look at the distribution of loss, how common loss is, who is most at risk of loss. And we also use these types of data to look at the consequences of loss for health, well-being, and other types of outcomes. Some of the types of data that we use, which you can look on the internet at these websites for more details on these data sets. We've looked at the National Longitudinal Survey of Youth, the National Longitudinal Study of Adolescent to Adult Health, and the Health and Retirement Study. All of these data sets are nationally representative and look at follow individuals over time. The first two data sets look at periods earlier in the life course following youth to ages 30 to midlife, and then the Health and Retirement Study focuses more on individuals from mid to later life. So we're able to look at patterns of loss and effects of loss on health across the entire life course. So we've looked at different specific losses, the loss of a mother, father, sibling, child, and spouse at different points in the life course. We've looked at exposure to multiple losses because some individuals are much more likely than others to experience more than one family member loss beginning early in the life course. And then, of course, we look at the timing of loss in the life course. We find dramatic and very consistent results indicating large racial disparities in the experience of loss. So, for example, in this graph, you can see from one of our data sets that focuses on people up to age 30, by age 10, Black children are over 3 times more likely than white children to have lost a mother, and they're almost 2.5 times more likely to have lost a father by age 10. If you look by age 20, you can see that Black Americans are over 2 times more likely than white Americans to have lost a child. We look here in 2 data sets, the risk of losing a child over the life course by age 30 in the NLSY data. You can see that Black Americans are almost 3 times more likely to have lost a child. And if we look at adults in later life, and losing a child becomes even more likely as we grow older, you can see by age 70 that Black Americans are almost 3.5 times more likely than white Americans to have lost a child, and by age 80, over 4 times more likely to have lost a child. Now, we've also considered multiple losses. We know from bereavement research that even one loss has significant effects on health and well-being over time. So this idea of multiple hits over the life course is extremely important because these are traumatic events that may build and have cumulative effects on health and well-being over time. We've looked here in this graph on the left, the risk of losing 2 or more family members by age 30 is about 3.5 times greater for Black Americans than for white Americans. And in fact, you can see that white Americans are about 50% more likely to have never lost a family member by age 30. Over on the right, we show our data for older people, and you can see from the Health and Retirement Study data that the risk of losing 4 or more family members by age 60 is about twice as high for Black Americans as for white Americans. So this is a dramatic story of racial disparities in the experience of loss. We know that Black Americans experience the loss of more family members, and in terms of timing, this begins very early in the life course, in childhood. And of course, we expect that these losses will affect the health and well-being of individuals, families, and communities. And we also find very consistent results in the results when we look at loss and the effects on health. So we know a lot from past bereavement research. There are hundreds, if not probably thousands of studies looking at bereavement effects on health and well-being. The vast majority of these studies have focused on white populations in the United States and Europe. So we don't really know that much about the possibility of racial disparities in loss experiences. We need a great deal more attention to research on race as a risk factor. So we've begun to look at this across a range of different outcomes for mental and physical health and in terms of dementia and mortality risk. Again, a very consistent pattern of results emerges. So I'm just going to show you a few examples here. This one focuses on the effects of losing a child on parents' mortality risk. And in this particular graph, we're showing the effects where we don't take into account other factors that influence mortality risk. And then when we do, so there are a number of demographic factors that influence mortality risk. You're more likely to die, for example. You have higher risk of mortality at early ages if you have less education. So we take into account those demographic controls here. And then we take into account a full set of socioeconomic controls. But regardless of that, even though it slightly reduces the impact of child loss on parents' mortality risk, it remains statistically significant, such that parents who have lost a child prior to midlife experience a significantly elevated risk of mortality compared to parents who have not lost a child after midlife. We've looked at a number of specific types of outcome, and we find the very same pattern of results when we're looking at poor physical health in later life for people who've experienced losses earlier in life. This is showing results for the loss of a child, but we find similar results for the loss of other types of family members. So we find the same pattern when we look at depression. Losing a child earlier in life affects depression later in life. It affects your risk of disability. It affects your likelihood of having cardiovascular disease. It affects your risk of dementia. And of course, as we have already shown, mortality risk. So what we've looked at with these population level data are the health consequences of loss. And we can clearly say that the death of a family member at any age has lasting effects on multiple health outcomes in mid to later life. We can also say, and I haven't shown you these specific results, but I can tell you that if all else is equal, there's no race difference in the effect of loss on health. So the effect of losing a child on your mortality risk is similar whether you're Black or white. However, all is not equal. Therefore, there is incredible racial disadvantage in terms of bereavement. We know that Black Americans have a health disadvantage even apart from loss. And that they have greater risk of losing family members, of losing multiple family members, and of losing family members even beginning in childhood. All of those things taken together point to tremendous racial disadvantage. This is a source of disadvantage that adds to health disparities that has not been highlighted in prior research. This is only beginning to receive attention. We have a tremendous public health challenge when we're looking at bereavement. There's no coordinated effort at the national or state level to document these losses or to mitigate the consequences of loss. At this point in time, it is very difficult to estimate how many people are affected by loss, how many children are affected by loss, adolescents, young adults, and into later life. Loss reverberates throughout family systems to affect all family members. As Dr. Verdery's research has shown, each loss probably affects about 9 individuals in terms of bereavement effects. So each death affects many, many people. This is a public health problem that remains in the shadows. We know many Americans are affected, including many children. We know that Black Americans are at greater risk of loss. This is an untreated and unrecognized public health problem and has many costs, not just for health, but for educational outcomes and for productivity. There are a number of action items that we can consider. We can begin to figure out ways to collect national statistics and data on the prevalence and consequences of loss in the United States. If we can identify who is at risk and why they're at risk, we can develop systems not only to target points of risk and resilience that we can activate to help protect individuals. We need monitoring systems to identify bereaved children and adults, whether it's in schools or in doctors' offices or in other venues. We need to identify vulnerable populations that need particular attention and develop evidence-driven intervention and policy strategies. Research can reveal those points of risk and resilience that can allow us to begin to address this problem. There are many people beginning to work on this problem, and many researchers around the country that have a great deal of expertise to bring to this issue. Policymakers need to come to the table, as well as other individuals who can bring attention to this issue. Thank you very much for your time. I hope you will feel free to look at my website and the websites of the other panelists who can bring attention to the specific details that you can use to launch very specified targets for intervention and practice. Thank you very much.